Hello, I'm Stuart Eglin, Director of NHS R&D North West. You're about to watch one of a series of films which we've put together to give you some indication of the kind of health research that goes on across the northwest of England. It's an opportunity to hear from some of the key leaders that lead the different health research organisations, units and centres and the like within the region. And what we've aimed at is to find out a little bit more about what goes on in those organisations and some of the stories and narratives that drive them. I hope you enjoy them and I look forward to your feedback. Thank you.
I'm Chief Executive of North West Coast Academic Health Science Network, and I came to that from being Chief Executive of a Trust and also the Chair of the Cheshire and Merseyside Comprehensive Research Network. So I had a good grounding in research and clinical trials, and the Academic Health Science Network takes evidence-based practice and technologies and research and puts them into practice. So it brings innovation to bear on the research and puts it into practice to impact on people's lives. So I've had a real journey from the start of research in the lab or with a trial to putting research into practice through innovative ways of working. Well, I came into the NHS in 2003 and I'd already had 17 years in local government, and my brother was really ill and he was in and out of hospital and he died, unfortunately, and I wanted to come into the NHS to make a difference just to the life of one person, because some of his care was brilliant and some wasn't so good. So I had a real sort of personal reason for coming into the NHS. And actually that led really nicely into thinking about research, because if we can do as much research as we can in this country and get ahead of the game for residents and patients, we give them the best treatments that we can. But throughout my career in different trusts, I've worked in a mental health trust, an ambulance trust, an acute trust, a tertiary trust, and there's been different ways of researching in each different trust. So I've seen some amazing impacts of research on people's lives. So when I went to Walton Centre as Chief Exec, we used to research and do clinical trials on patients who had Parkinson's disease. And one of them, we put her on a drug, she couldn't move, she couldn't hold a cup of tea, and as soon as she went on to the trial drug, she became like a new person. She came into the trust, she rushed round, she had been given a new lease of life. So I've seen some real instant results of research, and then I've seen some research studies that take a bit longer but help treatment to become better and to impact on the lives of residents. So one of the roles of the Academic Health Science Network is to bring together the triple helix of healthcare, universities and industry to make an impact on the lives of residents. And we've done a lot of work on that, on pulling events together such as our European Connected Healthcare Alliance, to put those people in a room with people who have got cutting-edge technologies, cutting-edge research, and looking at good practice examples so that we can then spark ideas in our own region and put them into practice. Well, one of the things we're really keen on at the HSN is to help residents be able to self-manage conditions. So for example, we have a work stream that's about preventing stroke due to early detection of atrial fibrillation and self-management of a condition. So the innovative way of putting that into practice is to give residents machines so they can test their own blood. They don't have to come into hospital and they can adjust the doses of the medication. We work on genome sequencing for warfarin guided doses, and we do community testing and give GPs and primary care organisations technology that means they can test for AF really quickly. So there's some real tangible outputs that improve the lives of residents and also help health professionals to be more efficient. I think it'll be viable in future to provide personalised medicine, but at the moment we're at the research and testing stage. So it looks like that's the future of healthcare, so we're keen to embrace that as an academic health science network, and we've been able to bring that to the region. So I think that is the future. The future is personalised medicine and digital health, so turning the current model on its head and rolling things out very differently than we do now, which is a challenge for healthcare professionals to sort of shake off the old model of treating residents like patients and to see them as people who can self-manage their conditions and can know about their own health through things like personalised medicines. Well, I think the future is digital actually. Like when we look at the generation that's coming up now into healthcare, they use apps, they use the phones, they use mobile technologies. They don't want to be coming into hospital or going into a GP surgery. So we need to move with the times. But also it's a really good way of stopping people coming into hospital. Hospital's a very old-fashioned way of doing things. And if someone can monitor their own condition because they've got the digital means at the fingertips, or they can be enabled to stay at home because sensor technologies tells the carer if they're going to fall or if they're getting out of bed when they shouldn't be able to. But that's where we need to be moving because it gives residents a better quality of life. Some of the technologies aren't simple to use and somebody needs to practice and be handheld into getting used to using them. And I suppose maybe we may have some people who aren't as familiar as they could be with digital technologies, but I see that as part of the role of health and university partners and industry in helping people to become skilled to use digital means of managing the healthcare and just digital using digital technology full stop. So if you're looking into Europe, they sort of class people as being older people when they're 50 in countries like Denmark and Holland, and they start to train people 50 and over in using digital means of ordering the shopping, looking at the healthcare, communicating with people. So we have a responsibility to start doing that. And on our footprint we have the more independent programme, the My programme in Liverpool, and that's exactly what it's been doing, training community champions to work with people across Liverpool so they become more familiar with digital technology and it's not frightening when they need to use it for healthcare. I think research is really important in the NHS. If we don't have good quality research, we won't get ahead of the curve for residents and patients in terms of having cutting-edge treatments and making sure that they have access to the best drugs, the best techniques and the best technologies. And innovation obviously is really important for putting that research into practice. So we've got one end of the spectrum where we're looking at new ideas and the other end of the spectrum where we're taking those ideas and making an impact with them. So both are really important in the NHS.